Now it's time for TIPisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Hi, my name is Chassidy. I am a registered dental hygienist, speaker, continuing education lover, wife, and caregiver. Today, I want to talk to you about being part of the Renal team, more specifically about what questions and tips you need to know and ask in order to provide safe quality care for our dialysis patients. In-center treatments are not the only modality for end-stage renal disease, or ESRD, and therefore the standard of care needs to improve. So imagine this. Your patient presents for a simple tooth extraction. The medical history is reviewed at either the recall appointment or the toothache and limited exam, and the dentist is already aware that this patient is a dialysis patient. However, this patient completes dialysis therapy at home via home hemodialysis 5 days a week. Per the medication list, the only blood thinner listed is a low-dose aspirin. The patient's last treatment was yesterday. All goes well with the extraction. It is a simple extraction, not surgical, but it's been 20 minutes and the patient is still bleeding through the gauze at the extraction site. Now, all measures are being taken with no results or little results, and it's now been 45 minutes. This scenario is very similar to the one when I received a call from one of my dentists asking for help. You see, I am not only a registered dental hygienist, but a caregiver to my husband, who is a home hemodialysis patient treating 6 days a week. So my dentist question that day was, what do I do? Now, this event ended up fine, but it raised concern that we as oral healthcare professionals are not asking enough questions for these patients to be treated safely. So here are the questions one should ask. You should start with, who is your nephrologist? This is the kidney specialist and head of the renal team. All decisions regarding care will most likely come from this physician. Now, where do you go for dialysis? Second question. There are 3 main dialysis types: in-center, home hemodialysis, and peritoneal. Home hemodialysis and peritoneal are both home therapy options, and important to know because it'll lead into your next 2 questions, as into how many days a week is your treatment and on what days. So for in-center treatment, typically you're going to go about 3 days a week on a Monday, Wednesday, Friday schedule, or Tuesday, Thursday, and Saturday. However, for home hemodialysis and peritoneal dialysis, your home therapies, they could be anywhere from 4, 5, 6, 7 days a week. Most of them are 5 days. For my personal experience with my husband, we are 6 days a week, sometimes 7. All of this is important to know because it will allow you to make a treatment plan and care plan as to when to safely bring this patient back to avoid any unnecessary risk. So then that'll lead into, when was your last treatment? Also important to know. For example, I talked about how many days a week is treatment and on what days. Well, if you are a home hemodialysis patient, for example, as my husband, and we are doing treatment 6 days a week, the question is, if this person needs a tooth extraction, when do you bring this patient back for safe care? So let's talk about that for just a minute before we go into our last question. So with his care, for example, we have the freedom and flexibility, and this is the same with peritoneal for the most likely, is we have the freedom and flexibility to treat at different times during the day, different days of the week. For example, if I'm going to work for the day and he feels like he needs dialysis, I may wake up really, really early before work and do his treatment before that time. So typically, if I were to do that and then he had an 8 o'clock extraction scheduled, that would not be the best way to treat this patient. But it does allow more flexibility when developing a treatment plan and care plan for them. So, question 6, do you pre-med or did you pre-med? So now that you know what questions to ask, there are some additional information you need to know and to take into consideration. So, all dialysis modalities use IV blood thinners for treatment to prevent clotting. I cannot stress that enough. So when you're reviewing the medical history, as I had mentioned in my opening story, they had listed low-dose aspirin, but they did not list the IV blood thinner. This is typical for most dialysis patients because it is something they're not taking by mouth. It's something they're not injecting themselves with. It is being injected into their treatment line before they get their treatment done to prevent clotting on the machine. So that needs to be taken into consideration, especially when it comes to how many days they're doing treatment in the week. In addition, all should consult with their nephrology team to determine pre-medication before all dental procedures. Most likely, they will have to pre-medicate before a cleaning, an extraction, you name it. And then I would like to also talk a little bit about organ transplant or kidney transplant patients. That is a end-stage renal dialysis option and most people on dialysis are looking for that as their end goal. So these patients typically have to wait 3 months after successful transplant for all dental procedures to eliminate the risk of rejection, any unnecessary infections that could alter their results with their transplant. And so it's important to find out their surgeon's information so that way you can contact them after that time to determine what their pre-medication protocol may or may not be. So I hope you find this information useful and that it gives you confidence treating this patient population. So if you have any questions, feel free to reach out to me at my email. It's Chassidy, Chassidy, period, Cassady, Cassady. Yes, that is my name, at gmail.com. You can also find me on social media and Instagram at Miss C Cassady. And I hope you have a great day.
A tale of two hygienists.